Good morning, everyone. My name is Janet Hazelton, and I wanted to give you a little update on what we've been doing at the Nurses Union since this pandemic was announced, and quite frankly, before it actually hit Nova Scotia, how we were preparing. As you know, or you may not, our office is closed and our staff are working virtually, and I want to say they are working. They're still answering each and every member's concerns and complaints through emails and telephone conversations and virtual meetings. So the business of the Nurses Union has carried on. However, it's been ramped up a bit, as you might be aware. Daily, we have conference calls with the Department of Health and other healthcare unions to talk about what's going on with the healthcare system, how prepared they are, what their plans are, where they're opening clinics, where they're opening test assessment sites. We also talk to the health authority every day to talk about the human resource effects of this pandemic, clinics being closed, what's the plan for the nurses and others working in those clinics. So we've been very busy trying to stay on top of the management from the union's perspective of this COVID-19 virus. And one of the biggest challenges from the union's perspective and our role is to make sure that the people we represent are provided with the proper equipment and are safe through this pandemic. So I'll start with the health authority. As I said, we've had many communications with the health authority about their plans to contain this virus, and what they are doing is they're opening up obviously testing sites, and they're trying to move those testing sites out of our facilities into places that are not connected to our healthcare facilities. People are being screened as they go into hospital to make sure they have no symptoms. And if they have symptoms, they're asked to go home, call 811 for further instructions, and that would require testings. And obviously, there's going to be people eventually that are going to be required to be in hospital either for a short term or a long term to treat their symptoms. The health authority is designating units across this province in various regions that will be the COVID-19 units in order to contain the disease and keep people safe, or as safe as possible. As far as PPE equipment, which is personal protection equipment, the position of not just the Nurses Union, but all the unions across this country that represent healthcare workers, we have decided that the best way to handle this is that the risk assessment will be done by the appropriate healthcare provider. In many cases, it will be a nurse. We'll do the initial assessment of the patient and or resident. And if they feel in their professional judgment that they require something more than the standard PPE, and the standard PPE is a shield, a surgical mask, gloves, and a gown. If the healthcare provider, the nurse in most cases, decides that this patient is exhibiting symptoms so much so that I feel I need an N95 respirator. And that's, as you know, a fit tested respirator that is provided to you by your employer. It's our opinion that if the nurse or others feel they need that to care for the patient safely, then they should be provided that. If the nurse feels that she requires that and is not given that, then she needs to contact her manager, the JOSH committee, and ultimately the union to talk about refusal to work. We have to be clear when we talk about work refusals. Many of you are going to be reassigned to another unit, one that you're not used to working on a regular basis. You cannot refuse that work as long as the employer is providing you with the orientation you need to do the work safely. You need to be reassigned, and that is part of your collective agreement. So that's acute care. So far, my understanding is no one is being asked to work in those units unless or until, first of all, until they're educated. There's mandatory education on the proper putting on the equipment, taking off the equipment, and other things that they should know to care safely for those patients. So that's being done. Also, to this point in time, my understanding is that nobody is being forced to work in those units, and they're looking for volunteers, which is a good thing. We have made a suggestion to the employer that they ought not to force any person that's immunosuppressed, that has a serious chest injury, serious chest condition, i.e. asthma, history of pneumonia, those kinds of things, and those that are pregnant, and those nurses that can that live with their senior mom, dad in their 80s, 90s, and they're responsible to care for them. So we need to protect those vulnerable people in our healthcare system that already are vulnerable, or they live with someone that is vulnerable. It is the belief that as long as we're provided with the proper protective equipment and that we practice good infection control techniques, which you will learn, if most of us know, but you will learn in that education portion of your orientation to work in the COVID-19, that there ought not to be the spread of COVID-19 amongst healthcare workers. It is the belief that there was a breakdown at some point in those that are getting ill from the COVID-19, and for the most part that would be not having the proper protective equipment on when they treated a COVID-19 patient. It is clear, and there's no argument about the fact that if a diagnosed COVID-19 patient were to fall ill and required intubation, potentially suctioning, everyone having to deal with that resident and or patient needs to have the proper equipment, which includes an N95 mask. So that's acute care. Long-term care, we're now starting conversations with our employer and the government about how are we going to treat when and if residents within our long-term care become ill with COVID-19. And there's a lot of work to do on this front, and everyone seems to acknowledge that. We don't have the proper amount of staff to deal with these very sick residents. We need more RNs and LPNs and CCAs in those units to make sure that those residents stay as safe as they can, as well as our staff. Lots of work to be done. Right now, it's not just the staffing, it's the equipment, it's the PPEs, it's oxygen, it's IVs, it's all of those things. I can assure you, we're in conversations with many of the long-term care employers to make sure that they are able to keep their staff safe. We know that if and when it gets in long-term care, it is going to be considerably more challenging because the residents may or may not understand self-isolation, so that's going to be an issue. We're not having the families in to help us look after their senior in the room, so that is going to be a challenge which will require more staff. So there's going to be lots of unique challenges, and we know this with our long-term care population, but I can assure you that your employer, government, and the unions that represent these workers are talking about this, just beginning talks right now, but we are talking about it and there's more to come. We also have had a lot of conversation with VON about our community nurses, whom we feel, not just the nurses, but others, are fairly high risk because they're in and out of people's homes. There's not the protection that long-term care and the hospital have, where there's screening at the door. They're being screened over the phone, but it's not the same level of screening, and we recognize this. So we are telling the people that we represent, nurses specifically, but anyone that's listening to this, if it's identified through the screening process that the person you're about to visit has had a visitor from out of province and or someone from out of the country that is staying with them or visiting with them, you need to talk to your manager on how you should deal with this. But minimally, if you were to go in to treat that person, you ought to be provided with your PPE kit, and you should or must wear it, because that individual could have touch something in the home, and then you touch it and touch your face, and then all of a sudden you have COVID-19, and you could be potentially spreading it to your family and the other people you visit. So we're going to try and provide very frequent updates to you about what's going on. We do have a COVID-19 web page on NSNU that I encourage you to read. A lot of work is being put into keeping it up to date with the very latest information. We have a link to a room called an escape room for those of you that just want to just chill out for an hour or so, just disconnect, stop watching the news, and just look after your mental health. There's movies, virtual tours, ebooks, audiobooks. It's very well done, and I encourage you to take time to visit it, and your family can visit it. Anyone can take the time to recharge and just relax and take some non-COVID-19 time, because it's very challenging. We are being bombarded daily, hourly, minute by minute about what's the latest on COVID-19, and sometimes it gets overwhelming. What I want to say, though, to all of the healthcare workers and the essential services is that people are recognizing more than ever just how much nurses and everyone else in the healthcare system and in the grocery stores and the police services and the paramedics and the transit drivers, just people realize now the risk we take each and every day being exposed to the public with whatever they are carrying. And I believe that the majority, if not all of Nova Scotians, realize that and appreciate it. I know that some of our facilities are getting pizzas dropped off for the staff and food and lots of thank yous and goodwill coming from the public. I think they understand now just how hard nurses, healthcare workers, and every other essential service in this province, how hard they work to keep Nova Scotians safe. They aren't lucky enough to be able to work from home or stay home and protect themselves and their family. Nurses and others are educated on how they are to keep their family safe, what infection control processes they should put in place in order to protect their families and their loved ones. But there's still a risk, and everyone realizes there's a risk. And we thank you for all of the risk that you take to care for Nova Scotians, putting yourselves above, putting yourself, your health, and potentially your families above your own is an admirable work, and we've so much appreciated it. The Nurses Union is going to work very hard to make sure our members are represented through this and that we do come out the other end. We know that this is a pandemic. We know that there will be an end to this, but we also know that we need to stay safe. We need people to stay home. We need people to self-isolate. We need people to not go into the communities, the stores, the pharmacies, unless it's essential. We need people to send one family member in to decrease the risk of the infection. So all I'd like to close with is thank you so much for what you do. If you have any questions, concerns, issues, just email the NSNU, check our webpage, talk to your colleagues, talk to your labor relations rep, talk to your employer, talk to your manager. You need to be comfortable in the space that you're going to be working over the next 4 weeks, 6 weeks, 8 weeks, however long this lasts. All of us need to be comfortable. We need to be safe. And we all know when people are informed, they do better work. When they're not scared, when they're given the proper equipment and proper education, they will do a better job. Thank you so much. And I recorded this at home, so if it's a bit off and my eyes are all over the place, I apologize for that in advance. I will try to keep you as updated as I can. Look for some more messages from me and perhaps others amongst our staff to talk about various issues that you may be experiencing. Thanks and have a great day. Bye.